Thank you, Chair Reynolds and Vice Chair Nguyen. For the record, my name is Dr. Maxine Dexter. I'm honored to be the state representative for House District 33, which is Northwest Portland and downtown Portland, as well as Cathedral Park in Linton. I'm grateful for this opportunity today to speak with you about House Bill 3303, which would establish Community Information Exchange, or CIE, governance in the state of Oregon. Social service provision must be done from a place of continued and connected care. As a pulmonary and critical care physician, I treat patients every day who do not have access that they need to housing, food, childcare, and other vital necessities that would ensure their holistic health. It is impossible to reach a place of sustained positive outcomes for these individuals without the integration of all social determinants of health. As it stands, clinicians and social service providers do not have the necessary communication and coordination systems in place to achieve this outcome, and this has resulted in a failure of our public health systems to comprehensively and effectively serve our most vulnerable populations. Community information exchanges are secure, closed-loop referral systems in which providers of medical and social services are able to communicate across sectors and disciplines about client need and ensure follow-up on referrals to other agencies and organizations. It is convened on a technological platform that functions with priorities of efficient and appropriate data sharing, guided by critical concerns for client data security, privacy, and informed consent as a foundation for its functioning. This bill is informed by and builds upon the previously passed HB 4150 in 2022, which directed Oregon Health Authority to the Health Information Technology Oversight Council, or HITAC, to convene community stakeholders in the health and social services to make recommendations to the legislature for how to best move forward in a collaborative and effective way towards Oregon having a functioning community information exchange that effectively engages and empowers community-based organizations, healthcare delivery systems, state agencies, and individuals needing service equitably. I'm grateful for the excellent work of this work group and the ongoing engagement of the OHA and ODHS to help us get here today. HITAC, through a CIE work group chaired by Carly Hood-Rodnick, spent the past 2 years in conversations with stakeholders, CBOs, identifying the most necessary facets of community information exchange that will connect Oregonians with those services that they are qualified to receive and are in need of. HB 4150 directed the group to, quote, accelerate, support, and improve secure statewide community information exchanges that would allow the seamless coordination of healthcare and social services across all delivery systems, prioritizing health equity, confidentiality, and the security of information. From this work group, they elevated the following recommendations. Number one, offer robust funding for CBOs to engage with CIE. Excuse me. Number two, promote equity, accessibility, and accountability. Number three, advance privacy and data protections. Number four, provide technical assistance, training, and education. Number five, create a statewide coordinating entity to promote alignment across organizations, sectors, and systems. Number six, prioritize relationships, communication, engagement. And number seven, align CIE efforts with other system-level efforts crucial to ensuring health equity. This bill has been responsive to these recommendations. So this bill, being 3303, is responsible to the recommendations from 4150, especially the fifth recommendation, which calls out the need for a statewide coordination entity to promote alignment across sectors. The ultimate goal is for any provider of care or service to be able to communicate with other providers or social service agencies or organizations to ensure holistic and effective support for all Oregonians, no matter what part of the state they live in. HB 3303 has been drafted not only from the recommendations of the work group, but from significant engagement with agency and provider stakeholders who have an interest in making sure that we are effective and secure with our community, with protecting their information, and also the security of our state. HB 3303 will establish a Community Information Exchange Board in the Oregon Health Authority as written in the -1 amendment. This board will consist of 10 members from the various regions of the state to be appointed by the director of the OHA in consultation with other agencies engaged in social service provisions. It will be made up of at least 6 members of community-based organizations that service culturally and linguistically diverse constituencies. No vendors with a vested financial interest in community information exchange implementation will have decision-making power. However, their feedback and expertise will be taken into account in a technical advisory committee. Its purpose is to learn from those on the ground doing this work across the state, and the work that is necessary to collaboratively develop best practices for community information exchange. They will also develop standards for data security and privacy, client consent, and other factors that contribute to the success of a collaborative and successful system of care. They will report yearly to the legislature on their findings as established in the -1 amendment. And work groups on both data privacy and technological interoperability and CBOs will be needed. And they'll need to talk about funding, staff capacity, technology. All of this will be operated through the board, and their findings will contribute to the best practices allocated by the board. The Community Information Exchange Board will also be tasked with convening additional advisory committees and focus groups in 5 regions, which will continue the work of the previous CIE work group in establishing the needs of community-based organizations and social service providers and maximizing their coordination and service provision. The Oregon Health Authority will be tasked with using the information to evaluate currently operating community information exchanges and to promote these best practices within those in existence and those that are continuing to develop. As our world becomes increasingly technological and interconnected, it is essential that we establish this method by which to evaluate the success of community information exchanges in facilitating the complete provision of care, especially for our marginalized communities, as well as protecting the rights of clients to decide to which level they would like their information to be accessible. I urge you all to consider this bill as a necessary step in providing wraparound services and support to our Oregon communities. We cannot continue to treat health as a siloed issue in the medical field, but rather as a holistic and collaborative effort that requires communication with many entities as a foundation of service provision. Thank you for your time and consideration, and I hope to answer all of your questions.
Any questions for Representative? Yes.
I do. Thank you, Chair. Can you define for me, I'm new here, can you define for me the community information exchange? Like, what specifically is that? I think I have maybe a little bit of a grip on it, but if you could dig into that for me, that would be helpful.
I mean, I can tell you, I can find the definition as we have it in the statute, which we did agree on one, and I'm trying to locate it. I know it's,
And I do think Ms. Otter may speak to that too.
So as it's defined currently, and then I'll go into what that functionally means, is a network of public and private social service providers and community-based organizations collaborating in the use of a multi-directional interoperable technology platform that includes a shared resource directory and closed-loop referrals to connect individuals and families to needed services and support, such as food, housing, transportation, and healthcare. So really, like, we're talking about it as a data utility, more or less. Like right now, each health information or electronic health record, you can have your own separate one, but it needs to be able to communicate with others, and building that ability to interface so that if a child's getting SNAP benefits and that family doesn't know that they're eligible for child care subsidies, that they are flagged. And then the system asks for the permission to make that referral to them. So it's not happening without their permission, but that you don't have to know as an individual, which I will tell you, my patients don't know what they're eligible for. Mm-hmm. And if we do that screening, and the one system was really trying to get to that too, but to allow them to, at one point, find out what they're eligible for, even if you showed up for, rental assistance, that you can see across the board. And we anticipate that this is going to work in school-based health centers, and sometimes the social workers and the school nurse at a school know far more about what a community of people need, and they're trusted, especially for some of our language and inaccessible services. Like in the school, there's probably the right interpretation that can help facilitate that. So it really is a means to getting people the services that they qualify for and deserve, but also being, thoughtful about how we do that, and it's with their permission and security in hand. So I'm trying to make the perfect system, and that's going to take some time.
Thank you.